Hi, good evening, ladies and gentlemen. It's a great pleasure for me to introduce our speaker today. She is going to talk about the novel next generation of basal insulin in management of diabetic patient. This is a subject in which we should all deeply interested nowadays because of diabetes burden in our healthcare system and still there is a need, despite all the medication is available in the market, there is a need to how to bring our patient, a diabetic patient, safely to be controlled. Our speaker is Dr. Jehan Abdullah, is a consultant physician endocrinologist in Bahrain Defense Force Hospital. Ladies and gentlemen, please join me in welcoming Dr. Jehan. Please, floor is yours.
Good afternoon, ladies and gentlemen. I'm going to talk today about management of type 2 diabetes with Toujeo, which is insulin glargine 300. As you know, diabetes has many challenges, which include it is increasing globally, suboptimal control, rate of hypoglycemia. There are limitations of insulin, whether basal or short-acting insulin. Diabetes is an increasing global epidemic. The estimated number by the year 2045, it will be around 629 million. The increase will be about 48% worldwide. And you can see the Middle East region is one of the highest. About 4 million people died from diabetes and its complications in 2017. So insulin is the mainstay of therapy of individuals with type 1 diabetes. A broad range of pharmacological options is available for type 2 diabetes. Frequent monitoring of HbA1c is recommended. And as you know that some patients then type 2 diabetes, they start with oral and they end up with insulin. And this is because of the due to progressive beta cell dysfunction, insulin is often required. So however, optimum glycemic control remains challenging for many insulin-treated patients. So many patients don't achieve glycemic targets. So many patients, they start basal insulin with HbA1c more than 9%. And to be honest, most of our patients, even they refuse. They will wait until HbA1c is more than 10. Few patients achieve HbA1c less than or equal to 7% after basal insulin initiation. Here, 42% had HbA1c more than 9% as baseline, but you can see after 3 months, 21% achieved HbA1c less than 7%. But with time, up to 24 months, only 28% achieved HbA1c. So the majority achieved HbA1c control within the first 3 months, which is a very important duration or time. So high hypoglycemia rates with insulin therapy and adverse impact, whether type 1 or type 2 diabetes patients, they all have high risk of hypoglycemia. And it's a very big problem. And hypoglycemia incurs morbidity and increased healthcare utilization. Hypoglycemia is a limiting factor in achieving good glycemic control. Effective therapy requires balance, so we need to balance between the benefit of a glycemic control and the risk of hypoglycemia. Effective and stable glycemic control, you need to improve HbA1c target, prevention of complication, flexible dosing insulin, improve adherence, but at the same time, we're looking for low risk of hypoglycemia to reduce fear of hypoglycemia. More optimal dose titration may improve adherence and reduce morbidity. So the fear of hypoglycemia, and I'm sure you have this problem with your patients, once they have a severe hypoglycemia episode, they'll be very reluctant to increase insulin unit. So fear of hypoglycemia, fear of a new hypoglycemic episode may lead to deterioration of a glycemic control. And this is because of decreased desire of the patient for tight glycemic control, reduced willingness to intensify therapy, poorer adherence to diet therapy, and compromised compliance for taking medication. So patients who had severe hypoglycemia or hypoglycemia tend to target always higher nighttime glucose level due to fear of nocturnal hypoglycemia. So hypoglycemia is a risk factor for later hyperglycemia-related complications. The development of insulin glargine took place at Sanofi in Frankfurt in Germany, and Sanofi supplies the product to over 100 countries and more than 3.5 million patients worldwide. On June 9th of June, the year 2000, the European Commission approved the launching of Lantus by Sanofi. A threefold more concentrated formulation brand name Toujeo was introduced after FDA approval in 2015. So there is 15 years between Lantus and Toujeo approval. But why do you think we need a new insulin or a new generation of insulin? A next generation basal insulin should go beyond HbA1c control for an improved patient experience. So even the significant evidences in basal insulin, there is a compromise between glycemic control and hypoglycemia. You need suboptimal insulin experiences, steer patients away from the goal. Aspiration of a new insulin, we're looking for insulin which is more stable, prolonged pharmacokinetic, pharmacodynamic, lower risk of hypoglycemia, flexible, very flexible of injecting time, and long-term safety with weight neutrality. See the difference between the drop of Toujeo, which is the glargine 300, and Lantus. So more insulin in every 1 ml versus Lantus. So each unit of Toujeo has 1/3 the fluid volume of Lantus. The smaller injection volume of Toujeo results in, because it's more concentrated, so slower release. So compact depot formation results in more gradual insulin release with the glargine 300 in comparison to glargine 100. So it's a smaller volume of injection, more compact subcutaneous depot with a smaller surface area, but it is more gradual and slower release from the depot. So Toujeo is a novel insulin glargine formulation because it has the reduced depot surface area by almost by half of Lantus. So at the same time, because it's very concentrated, it is more stable, prolonged. So you can see here the green line, it goes beyond 24 hours. And the pharmacokinetic, pharmacodynamic profile with Toujeo here versus Lantus, usually it is less fluctuation and more stable. Toujeo offers consistent, lower confirmed and severe hypoglycemia. Here we have hypoglycemia at any time and nocturnal hypoglycemia. Whether hypoglycemia at any time or nocturnal, you can see the green one is Toujeo has less incidence. So the high risk of hypoglycemia or the incidence of hypoglycemia with Toujeo, whether nocturnal or any time, it is less in comparison to Toujeo. Toujeo is in comparison to Lantus. Toujeo is associated with less glucose fluctuation compared to glargine 100. Clinical benefit, so we have here duration is action is more than 24 hours and it is once a daily injection. Flat pharmacokinetic and pharmacodynamic, and it is more flexible injection timing, lower risk of hypoglycemia, low variability in insulin exposure and action, and facilitate insulin titration. So glargine is more compact, more gradual, slower release of insulin from the surface of depot, more constant and prolonged, more stable, and low within-day fluctuation and between-day variability. So if you compare between these two guys, we are not going to compare actually, if we're going to assess safety and efficacy of Toujeo in comparison to Lantus, we need a program which is called EDITION program. It's a clinical development program. In this program, the objectives is to assess the clinical efficacy and safety of glargine 300 or Toujeo in comparison to Lantus. So they randomized 1-to-1 open-labeled parallel group multi-center phase. EDITION program was built with similar study design across the trials. So here, there is just to show in this study that Toujeo is not inferior to glargine 100 in terms of HbA1c reduction. We have many of additional programs, some of them in type 2 diabetes, for type 2 diabetes, and some for type 1 diabetes. We have like EDITION 1 for they use basal insulin, more than 42 units, plus bolus insulin. In EDITION 2, they use basal plus oral. EDITION 3, insulin naive patients, and EDITION JB2, basal insulin in Japanese patient. And type 1 diabetes, they have EDITION 4 and EDITION JP1. So consistently effective glycemic control, this is all EDITION program. You can see that Toujeo is not inferior to Lantus in terms of HbA1c control at 6 months duration, whether it's in EDITION 1 up to EDITION 4 or all of them. After 6 months, similar reduction in HbA1c versus Lantus in all type 2 diabetes, and actually the reduction was more in Toujeo group by 1.42%. Toujeo provides significant sustained HbA1c reduction at 1 year. So you can see the reduction in HbA1c sustained up to the end of the study, which is after 1 year. Switching to Toujeo results in significant less risk of hypoglycemia. So nocturnal hypoglycemia was less by 48% in comparison to Lantus, and any time of all-day hypoglycemia was less by 23% in Toujeo group in comparison to Lantus. More constant glucose profile with Toujeo compared to glargine 100 regardless of the time. You can see it's more constant in comparison to glargine 100 or Lantus. You can see there is fluctuation. Flexibility, it's more flexible because we have 6 hours window. There is plus minus 3 hours. So Toujeo offers once daily dosing, and their benefit of dosing is very flexible, either plus 3 hours or minus 3 hours, because it's extended duration of action lasting up to 36 hours. And average glucose profile evaluated here, and like we see in this one, in CGM of patients with type 2 diabetes, you can see it's more stable. Switching to Toujeo offers significant less weight gain. Weight is very important, and it's a major concern for the patients when you start them on insulin. And here, during the study, the addition program, they found that patients who received Toujeo, they have 88% less weight gain in comparison to the group who received Lantus. So comparable A1C reduction to glargine, but with lower risk of hypoglycemia in type 2 diabetes, low or similar risk in type 1 diabetes also during the titration period, smoother pharmacokinetic, pharmacodynamic profile of a glargine 300 versus 100 was associated with reduced daily glucose variability and lower risk of hypoglycemia, dosing flexibility plus minus 3 hours, and convenient administration with easy to use Toujeo. So when comparing Lantus and Toujeo, Toujeo has which is a novel next generation of insulin glargine, more stable, lower risk of nocturnal and anytime hypoglycemia, dose flexibility, significant less weight gain, and long-term cardiovascular safety and clinical experience of insulin glargine. So here, how to start Toujeo. If you have a patient insulin naive and you want to start this patient on Toujeo, you can start with 0.2 units per kg, like this lady here, and according to the weight. So if the weight, for example, is 100, you can start with 20 units. In type 2 diabetes patients on once daily basal insulin, it's very easy, just to switch 1-to-1 conversion. And we have like patients on Lantus 18, you will give them 18 units of Toujeo. Type 2 diabetic patients who received the twice daily basal insulin, you can start with 80% of the total insulin dose. And then you can increase the dose, up titrated according to blood sugar readings. If the fasting blood sugar is 140, you can increase it by 6 units. If it is between 100 and 140, you can increase it by 3 units. The goal is between 80 to 100. And in case of hypoglycemia, you can reduce it by 3 units. I'll just show you here, this is one of my patients who presented to the clinic on 4th of October. He's a 54 years old male, known case of diabetes on dimicron, changed to Amaryl recently, vildagliptin with metformin. He was on glargine Lantus 18 units, HbA1c was 11%. When I saw him in October, I changed from Lantus to Toujeo, and he came back in March. HbA1c dropped to 7.2. You can see previously his blood sugar was never controlled. It was always around 10, 11, 12. But once he started on Toujeo, his HbA1c is very well controlled. Another patient, this is a 63 years old male, known case of diabetes, hypertension, dyslipidemia. He was on Lantus 18 units, but always his fasting blood sugar between 8.8 to 15 millimole. So I switched this patient from Lantus to Toujeo 18 units. I did not increase the dose, but his blood sugar readings improved to 6 to 11 millimole after 1 week. So Toujeo making the ideal even better because it's more stable and prolonged, a lower risk of hypoglycemia, whether nocturnal or anytime, significant less weight, and more flexible. Even the pen itself, it's very convenient to use. You can see the hold time, it's only 5 seconds. So 95% of first-time insulin users with type 2 diabetes rated the Toujeo pen as easy to use at the end of the 4 weeks study. So some patients requiring high dose of long-acting insulin may take fewer injections with Toujeo pen if switched from Lantus to Toujeo. The other good thing that storage outside fridge, it's about 56 days in comparison to Lantus 28 days. And the less hold time with pen, it is 5 seconds with Toujeo and 10 seconds with Lantus. So if you have an option between Mercedes model 2000 and Mercedes model 2015, which one you will choose? I hope after all of this you do agree with me that Toujeo has beaten Lantus. Thank you.
Thanks, Doctor, for the fruitful presentation for today. It was a real pleasure to join the presentation for today. I hope Toujeo will continue the success we already met before with Lantus, with better profile, as you mentioned, as in controlling and hypoglycemia, with easy switch. So I hope, inshallah, in the upcoming period, Lantus will be replaced for Toujeo or upgraded to Toujeo. Thank you.